Are you wondering how to tell the difference between Braxton Hicks contractions and real labor contractions? I'm Dr. Monica. I'm a board certified OBGYN and mom of three, and I want to help you figure out how to tell the difference between the two. So let's start with Braxton Hicks. You may have heard of these also referred to as false labor or practice contractions. Practice contractions is kind of accurate because it's your uterus practicing what it needs to do for labor without really being in labor. So what can we do to figure out which one it is, if it's a Braxton Hicks or if it's a real labor contraction? Let's talk about a few different characteristics. So first of all, the sensation that you may feel. In a Braxton Hicks contraction, what you'll feel is that your belly and your uterus get very firm and hard. That's the main thing you'll notice is if you touch your belly and your uterus, it feels like it's actually hard. Now, this is not painful. That's a very key differentiation between the two. You might feel a little bit uncomfortable, and ladies who have had multiple babies may notice that with subsequent babies, it feels a little bit more uncomfortable than prior, but it should not be painful. The main thing in the way you feel it is whether or not there is pain associated with it. A real labor contraction will be painful. Pain may start in your back and wrap around to the front of your belly, or it may kind of focus in your belly and even push down and notice it into your pelvis. This is a very painful sensation versus a Braxton Hicks, which is just uncomfortable. Sometimes it will kind of take your breath away a little bit, but not because of pain, just because that's the sensation that you notice. So that's what the two feel like. How about the timing of the two? A Braxton Hicks contraction is usually going to last for about a minute or less, whereas a real labor contraction is usually anywhere from 1 to 2 minutes in total, with a peak of intensity in the center part of that time frame. Another thing that's really important to tell the difference between the two is the timing. This is probably the best way to tell which one you're having because they tend to stick to these two different trends. So a Braxton Hicks contraction will sometimes come on kind of frequently. Like out of the blue, you feel this bit of tightening and then it goes away. Comes back in a few minutes, goes away, and then it's back again. Then you don't feel anything for 10 or 15 minutes and you have another little run of contractions. This irregularity and inability to time them, as well as them tending to be kind of frequent, is more characteristic of Braxton Hicks. Now, labor contractions tend to follow a more consistent pattern where they start off being infrequent, maybe every half hour, every 20 minutes. Then you'll notice they increase in frequency where now they're every 15 minutes, now they're every 10 minutes, now they're every 5 minutes. And as they increase in frequency, they also increase in intensity. So they get closer, longer, and stronger as they move on in time. This is how you can tell a labor contraction because it will follow that trend. The other thing that can help tell the difference is that labor contractions will stay on until a baby comes because you're in labor. Braxton Hicks will go away. So Braxton Hicks will go away either if you change positions, so if you were laying down and noticed them and got up and walked and they went away, or if you were up moving around and then you laid down for a little bit and they went away. Or they may just go away all on their own. Generally, Braxton Hicks will last for a while, have that irregularity for either a few minutes or a few hours, and then they'll just go away on their own. Whereas, like we mentioned, labor contractions are here to stay. Now, another type of contraction that's not really in either one, it can be referred to as prodromal labor. So what this is when you are having painful contractions, but you're not really in labor. So how do we know if you're in labor? Let's first talk about what is the definition of labor. Labor is defined as painful uterine contractions that cause cervical change. So prodromal contractions are something that happen when you do start having painful contractions. They're usually not that close together, but when your cervix is examined by either a nurse, a midwife, or a doctor, your cervix is not making any change. So you are not technically in labor. However, these contractions tend to feel more uncomfortable or even painful as opposed to Braxton Hicks contractions, which are not painful. So this prodromal labor sometimes occurs a few days before real labor sets in. It's more common in first-time moms who have not had a baby before. And it can definitely be a little bit uncomfortable to deal with, and it can be a few days of not feeling great. But ultimately, usually these will either go away on their own or they will progress to real labor. So that's a general idea of how you can tell the difference. If you're ever not sure, you can always call your doctor or your practice or midwife to get some detailed information based on what you're experiencing. But that is a general rundown of Braxton Hicks versus true labor contractions.